Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and to help the caregivers and patient to access the right treatment on right time. So as you all know, today in the continuation of our last session, which was on head and neck cancer awareness month continuation. So today also let's acquire a little bit of more knowledge about the head and neck cancer. So today we have our esteemed expert, Dr. Krishnamani, a highly respected medical oncologist who has more than 10 years of experience in treating different and various kinds of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. Thank you very much, doctor. So let's extend a warm welcome to Dr. Krishnamani.
Hello, everyone. Welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Thanks for tuning in. And today, let's talk a bit about the basics of chemotherapy and immunotherapy, targeted therapy in head and neck cancer. We'll not go too much into the medical part of it, but from a patient point of view, what's important, who are the people who will receive it, what precautions you ought to take. These are the things which we will concentrate on.
Thank you, doctor. Thanks a lot. So, guys, without any further ado, let's begin with chemotherapy and immunotherapy in head and neck cancer. You can say head and neck cancer awareness part 4. So, doctor, just to understand, what is the role of chemotherapy in head and neck cancer, doctor?
So first, let us understand what is chemotherapy for our audience. So
Yes.
chemotherapy is a cancer killing or a cancer controlling drug. It can be given as an injection in your vein, or it can be given as a tablet. Okay. It can be given by other routes also. Commonly, it is given as an IV injection, intravenous injection. It is given in a bottle of saline over a few hours. So chemotherapy means a drug to kill your cancer cells or to control or to prevent them from dividing. We have discussed multiple times on our platform. When we talk about treatment, your first question should be, what is the intent of treatment? Intent means, why are you treating me? Is it for cure? Is it for palliation? So chemotherapy is given for either cure or palliation. So if it's an early stage disease, you are giving me medicines or chemotherapy to cure my disease. If it's an advanced stage disease, you are giving me chemotherapy to palliate. Palliate means shrink the disease, improve my symptoms, improve my quality of life, and make me feel better, reduce my pain and suffering. So that is the role of chemotherapy in any cancer, including head and neck cancer. So chemotherapy, being a cancer affecting or a cancer killing drug or a cancer controlling drug, is used either for cure or for palliation to improve the quality of life and to reduce the burden of the disease and to also increase the survival finally. That's the role of chemotherapy.
Sir, like you were referring about the palliation. So the palliation will also continue with the entire removal of cancer, or it will just, the cancer will be remained and the patient will live a life with that cell like that?
So see, how now so what you are asking is, you are asking what will be the response. Okay.
Yes.
So for somebody, so imagine there are 3 cancer patients, all have stage 4 disease.
Okay.
So for all you are giving same disease, you are suggesting chemotherapy. Okay. Now this chemotherapy in stage 4 disease, is it for cure or palliation? It's for palliation because it is stage 4, it is not curable. So I have all these 3 people have head and neck cancer, all have stage 4 cancer. You are giving chemotherapy to palliate. What are you going to say? It is not curable. I will reduce your disease so that you live better and your quality of life is better. Now, will the medicine work the same way in all the 3 people? No. So no disease is the same. Is blood pressure the same in everybody? Is diabetes the same in everybody? Does everybody take only tablet? Why do some people take insulin? So same way, why does chemo work in some people and the same chemo doesn't work in another person? So that is the whole point. So
Yes.
what you are going to tell is, see, we are going to give you chemotherapy. In one person, you may, so out of the 3, what are the responses you may get? One, the disease may completely disappear. It is called complete
Yes.
response. One,
Okay.
the disease may partially come down. It is called partial response.
Hmm.
One, the disease may remain the same, static, called stable disease.
Hmm.
Another thing is, chemo may not work, it may lead to progression. Disease may increase, that is called progression.
Yes. Okay.
So, what was your question? That once you give treatment for palliation, will the
Palliation.
cells
Hmm.
die, or will everything disappear, or something will remain? So that
Yes.
depends on the response you get. If it's a complete
Okay.
response,
Okay.
everything will disappear.
Everything. Yes.
If
Very true.
partial, you cannot decide beforehand in whom you are going to get this and that. Okay, it is like telling today that Virat Kohli will definitely hit 100. You cannot. So same way,
Cannot.
you
Yes.
cannot predict which chemotherapy will produce what kind of response in what percentage of the population. But
Okay.
broadly, what you can say is on day one also, what you will tell your patient is, see, even if you have got complete response, because it is stage
Hmm.
4, remember that it may come back at some point in time and haunt you.
Oh,
If you get a complete response, you are the best.
well and good. Yes.
But remember that despite having a complete response, there is a chance that the disease may come back.
Come. It is like may come kind of. So, doctor, like when you are just giving us a brief about the chemotherapy in head and neck cancer. So, in which situation, and can you just brief where it is used or like that?
So
Little bit brief on it.
you use it in the curative setting, you use it in the palliative setting. Let us go to
Okay.
palliative. Palliative is in stage 4 or advanced cancer patients,
Yes. Just now
usually
brief.
given by the IV route, or we call metronomic therapy. When somebody is very old, frail, unfit for treatment, for IV
Hmm.
treatment, when IV treatment has lot of side effects, you go for tablets, which is called oral metronomic therapy.
Okay.
Okay. So basically,
Hmm.
it is used in advanced stages. Chemotherapy in advanced stages as a palliative chemotherapy.
Okay, doctor.
Now, in curative, when you want
Hmm.
cure, chemotherapy can be given either before surgery. We have discussed this, which is
Yes.
called
Yes.
neoadjuvant chemotherapy. Chemotherapy can be
Hmm.
given after surgery, which is adjuvant, or chemotherapy can be given with radiation in head and neck cancer called concurrent. Concurrent means both are going together.
Oh,
So,
okay.
in what setting do you use chemotherapy? In palliative setting. Forget that. In
Hmm.
curative, I will give it either before surgery or after surgery based on the
Okay.
risk of recurrence, or with radiation, which is called concurrent chemoradiation.
Okay. So it is like depending upon the patient situation, the chemotherapy or the palliative therapy is decided for a
Yes.
patient.
Stage will decide whether it is palliative or you're trying for cure. Now, the site of disease. Now, suppose it's a voice box tumor or a laryngeal tumor. You
Hmm.
will not want to operate. So you will look at
Okay.
non-operable methods like radiation. So improve the efficacy of radiation. You will add chemotherapy.
Okay.
Or
Hmm.
sometimes prior to radiation for organ preservation, we give chemotherapy.
Okay. Yes.
Okay.
Hmm.
And then in some cancers after surgery,
Hmm.
if there is a node, if there are certain bad factors which predict that the recurrence will be there, then we give chemotherapy.
Oh my God. Okay.
So
Yes.
chemotherapy is either to shrink the tumor or given after surgery to prevent recurrence of the tumor, or given with radiation to improve the effect of radiation, or given in the fourth stage to improve your quality of life and increase the survival.
Oh my God, doctor. Then in this treatment, frankly speaking, every patient will have different methods. So every patient will
So,
be with the new treatment process or new treatment
so
initiation kind
very
of a
true.
thing.
It's just like our five fingers. They are not alike. So the treatment is not alike in everybody.
So actually, generally, what happened like paracetamol, it is like when you have headache, you take paracetamol. It is same for everybody, but the cancer treatment is not at all same for everybody. Oh my God, that's quite challenging. So, doctor, like when you are talking about the chemotherapy, can you just give us a small brief, like what are the regimens which are used in this head and neck cancer?
So you use, I told you, the oral therapy, which is metronomic
Yes.
therapy
Hmm.
in advanced cancers, unfit patients. You use IV therapy, which can
Hmm.
be weekly. We give it every week with
Okay.
radiation sometimes. Or
Okay.
sometimes we give 3 weekly chemotherapy, which is a medicine called DCF, we say. D for Delhi, C for Calcutta. Okay, DCF. DCF is a very powerful chemotherapy given once every 3 weeks. Then we give a
Oh.
regimen called 5F uses platinum. This is one of
Hmm.
the best regimens in head and neck cancer. Then we use
Okay.
a medicine called paclitaxel carboplatin. That's one of the very good regimens which we use either weekly or 3 weekly. If somebody is fit enough, we give it 3 weekly. If somebody is borderline status, we give it
Hmm.
weekly. So
Okay.
basically, there are multiple medicines. What we have to understand is your doctor may advise it weekly if it is given with radiation, or sometimes weekly if your general
Hmm.
condition is a bit frail, or
Hmm.
3 weekly if you are tolerating well.
Okay. So again, the decision of the medicine will be also depending upon the patient condition only.
True.
Okay. So doctor, like when you are talking about these different kind of regimens, can you just brief us what can be the side effects? Because when the cancer, we hear the side effects are very uh,
Yeah. So
many.
when we talk about side effects, what we usually tell people is classify the side effects. What are the immediate side effects of chemotherapy?
Hmm.
What happens when you start taking chemo? S- It will not happen in everybody, but what are the potential side effects? The,
Vomiting.
the time the medicine is going, you may feel chills, feverish. You
Okay.
may have a breathing difficulty, or you may go into some kind of a reaction. We call it anaphylaxis. You may get some
Okay.
rashes, itchy
Hmm.
sensation, and all that. Then, as you
Hmm.
said, nausea, vomiting, feeling of weakness, headache, feverishness. This is immediate during infusion.
Okay.
Early side effects within the first 48 hours or 1 week: vomiting, nausea, fatigue, weakness, okay, mouth soreness, spicy bitterness in the mouth. Okay. A week later, you will have fallen your hemoglobin, your WBC count, your platelet counts, alopecia, hair loss will start,
Yes. Yes.
weakness is already there. And very late side effects can be sometimes chemotherapy over after many, many years can damage your heart or maybe lung or your nerves, which is called neuropathy. Very rarely patients get second cancers due to chemotherapy, less than 2%
Oh.
patients.
Hmm. Hmm.
So side effects are immediate, which can be fever, rashes, chills, shock, anaphylaxis, we say. Early side effects like nausea, vomiting, weakness, loss of taste. Late side effects, which could be the same and fall in the counts: WBC, hemoglobin, platelet, infections, fevers, hair loss, discoloration of nails, all that. And very late side effects can be organ. Patients may become infertile, they may not be able to conceive.
Oh.
Okay,
Okay.
sperm production, OA production may go down. So these are all the side effects. Why in head and neck cancer this is more important is in head and neck cancer patients, see the cancer is here. If
Oral.
you do radiation, there's going to be a burning sensation in the throat. If you're doing surgery, there's a lot of disfigurement. The dentition is not there. Tongue, if you have a tongue cancer, part of your tongue would be cut out. Okay.
Yes.
So if you have a cheek cancer, part of the cheek may be
So
removed.
removed.
So your saliva production, your deglutition, your mm, biting, all that is impaired. Chewing is impaired. So the tumor is
Yes.
there, that is troubling you. The treatment is there, that is troubling you. On that, your chemotherapy can, if you don't gargle well, you will develop mouth ulcers, fungal infections. So these patients are prone to poor nutrition after that, which we discussed in our earlier
Yes.
episode.
In the last session. Yes.
Right. So this impairs the nutrition. They become cachexic, they lose weight, they become skin and bone.
It
So
is
these
like
are the
doctor.
issues.
Hmm. Sorry. Sorry.
No, no, these are the issues.
So this is like doctor last in the last session when we were discussing about the nutritions, how to take and what is the challenge of taking the nutrition. I guess this is the exact challenge how the patient will lack of nutrition because they are unable to consume nutrition through oral source.
Yeah, they can't swallow, they have a burning sensation,
Yes.
they have mouth ulcers, they have dryness or over salivation, poor dentition, restricted mouth opening, on that
Yeah.
vomiting sensation, vomitings, fever. weakness, anything they put in their mouth, they have that spicy feeling.
Pain and that separate pain.
So these are all the added effects of chemotherapy in head and neck cancer patients.
Oh, such a challenging doctor. So, doctor, like during this treatment, what are the precautions to be taken, doctor?
So we tell all our head and neck cancer patients, all our cancer patients to gargle their mouth well to prevent mouth ulcers. There are
Okay.
excellent medicines available for vomiting now, which will be given to you by a doctor. And after that, also, we put them on good amount of antiemetics or anti-vomiting pills for 3 days to 5 days. Take home food, small quantities multiple times a day. Reduce the spice or the masala in your food. Take predominantly
Mm.
fruits, vegetables, fruit juices, homemade food, less spicy. Eat at multiple intervals. Drink lots of water to keep your mouth hydrated. So these are all the precautions we have to take so that uh, we try to reduce the harmful effects of treatment or
So,
the
like you
side
were,
effects of treatment.
so you were referring to the long-term treatment like coloration of nails, hair loss, skin some changes. So even that will be a very long process, or it will be for a short period only during the treatment, or
So it's only during treatment. So once you stop your chemotherapy, your hair is going to
Hmm.
come back. May not be in the same texture, but it will come back.
Okay.
Your weakness will disappear. Your fatigue will disappear. Little amount may be there. So these are all reversible side effects.
Okay, good. That though it getting cancer is a very bad thing, but yes, the precaution and the reversible side effects can be also a hope for them. So,
Yes,
doctor, like,
hemoglobin comes to normal. WBC becomes normal. Platelet becomes normal a month after your chemotherapy generally.
okay. So, doctor, you were talking this something regarding the chemotherapy. So, what exactly is immunotherapy? Like, how both are different, and what is exactly immunotherapy in head and neck cancer?
So immunotherapy, we discussed it earlier also. It's a medicine which boosts your immunity or which uses your body's immunity to kill the cancer. It is
Okay.
started with skin cancer, melanoma, kidney cancer, lung cancer. It is used in head and neck cancer and other cancers like stomach, esophagus, etc.
Hmm.
So slowly, the world wants to move away from chemotherapy because we know the side effects of chemotherapy. And at every progression, you can't keep hitting the patient with chemo because at every progression, they are becoming that much more weak and they may not be able to tolerate the chemotherapy.
Okay.
That's
Hmm.
why you also want to look at any other novel medication like immunotherapy so that you can improve their life without giving them side effects of chemo. So
Okay.
immunotherapy is different from chemo in action. It boosts your immunity.
Okay. Hmm.
Immunotherapy doesn't have chemo side effects.
Okay.
Okay.
Yes, best. Hmm.
For immunotherapy, generally we do a test called PDL1. If it is on the higher side, above 20, we say, okay, go ahead and take immunotherapy. You will have better results. Immunotherapy has different side effects like we said, like thyroid, hypothyroidism, pancreas issues, liver enzymes, skin rashes, those kind of things which are manageable. So that's how it differs. And the whole
Okay.
premise is that can we, in some set of patients, not give chemotherapy and give an alternate medicine like immunotherapy with less side effects or no
Okay.
chemo-related side effects and control the disease?
So, in short, doctor, like we can, in some patients, like you were highlighting, we can avoid chemotherapy and we can only give immunotherapy and take care of the cancer in that patient. Is it something?
Yeah. So where do we avoid chemotherapy? When somebody has progressed on chemotherapy, the next option is immunotherapy.
Oh, okay.
Or when somebody has small volume disease, the disease is not
Hmm.
much, very little disease, you will give immunotherapy.
Okay.
So this is where you try to do.
So, in short, doctor, when the patient is in fourth stage, I guess chemotherapy or the palliative therapy will be the choice of treatment, doctor.
So chemotherapy and immunotherapy are two pillars right now in the management of advanced head and neck cancer.
Okay.
Yeah. If somebody comes with advanced head and neck cancer now, if the
Hmm.
PDL1 score is about 20%, we can directly go for immunotherapy. If you feel
Okay.
there's a lot of disease, you can add chemotherapy to immunotherapy, stop chemotherapy after a few months, and then continue immunotherapy.
Okay. So good, na doctor. Even the side effects will be less, and also I guess the success rate will also be more with, as if I'm not wrong, immunotherapy is the more latest technology.
Yeah, it's a latest medicine available anywhere in the world now. It's available in India too. As an example, now we have a gentleman who came to us almost 2 years back with the advanced head and neck cancer. He was started on chemotherapy plus immunotherapy. He stopped chemotherapy after 4 months. Immunotherapy is continuing even today. He's doing extremely well. So
Okay.
many people will have such examples, not only us or not only me. So the bottom
Hmm.
line is you have to select your patient very carefully. You have
Hmm.
to use the medicine in the right setting, right indication. Tell your
Okay.
patients that, see, immunotherapy is not a miracle drug. It will not work for everybody and anybody. But
Yes.
if it works, the responses are durable. That is, it will work for a longer period of time.
Wow, that's actually a technology which we can say how it is developing day by day, doctor.
Yeah, um, this is because of the effort of all the researchers, which or research work which has been put in by great minds to bring out these kind of molecules.
Sir, all credit goes to you, doctors. Sir, actually, without this research and without this, I don't know how many people can be surviving. Anyhow, chewing tobacco, they cannot stop. Getting cancer is something like they will or they will not. But after getting cancer, without you, it would be very difficult for them to come out. So thank you, doctor. Thank you very much. Today, actually, this was a very interesting and informative session, but too much, I should say, a knowledge gathering session, doctor. In fact, I should say. So, doctor, here a learning is the newer technology and the newer technique. The cancer treatment is available, but yes, better to avoid cancer than after getting treated with the cancer. So, doctor, would you like to give some closing session to this exciting session?
Yeah. So this is a very big topic. I have deliberately not gone into the medical details of chemo
Yes.
and immunotherapy because otherwise we can talk for hours on this. Number one. What our patients should understand is, why am I receiving chemotherapy or immunotherapy? Is it for early stage or advanced stage? Is it for
Hmm.
cure or for palliation? What is the expectation from the doctor or from the physician? And what should I expect as a patient? What are the
Yes.
potential side effects? Side effects when combined with radiation, side effects when given after surgery, side effects with immunotherapy or with chemotherapy alone or with combination. What a patient should expect. Take your vomiting pills, gargle well, drink lots of liquids, avoid spice, avoid mouth ulcers, stop tobacco for sure. Okay. Periodically visit your doctor. Get your scans done at regular intervals as suggested by your doctor. So these are all the things which will take you towards a healthier life. That is what we
Very
aim to. And immunotherapy is a new kid in the block. We are slowly trying to move away from chemotherapy in advanced cancer.
mm,
Metronomic therapy is for the extremely fragile, frail people who cannot take IV chemotherapy. And finally, a small word. Uh, Immunotherapy is expensive. Many people cannot afford. And some
uh,
of our colleagues have done a lot of recent good work and they have published their work on low dose immunotherapy. And they have shown that
okay.
low dose immunotherapy, which is inexpensive or less expensive compared to the standard dose immunotherapy, they have used 1/6 of the dose. So the cost comes down by 1/6. If it is 1 lakh, it comes down to 15,000, just as an example. And it has good results or equivalent results.
Oh,
So
wow.
not only
Mm,
researchers elsewhere, even our own clinicians and our own colleagues are doing excellent work. And all
wow.
that is also, that work is also towards betterment of patient life with improving the cost of the treatment, also reducing the cost of treatment rather, so that the expenditure from the patient's pocket comes down, out of pocket expenditure we say, so that that comes down. So the whole aim is a holistic one where financially they are empowered, they don't spend a lot, or the expenditure comes down significantly, they get the best kind of a treatment also with the best
Mhm.
intention at heart.
Wow, doctor. Actually, doctor, the credit goes to all of you. Thank you very much because this day-to-day activities or day-to-day research which is coming out, which is helping our patients a lot. Obviously, as you rightly said, pocket-wise also and also the health-wise also.
Yeah.
So thank you, doctor. Thank you very much
Thank you
for
so
this
much.
and lighting session. Thank you everybody for having us having over here and being a part of this excitement session and such an informative session, which is chemotherapy and immunotherapy in head and neck cancer. So before closing, we will just wish you all strength, hope, and good health from Cancer Reach. Thank you very much.